I'm going to go ahead and just take a second to introduce myself. My name is Amelia George. I'm the Public Programs Manager at the Museum of Northern Arizona. And we're really grateful to be here talking with you with Dr. Ken Bernard and a very good, dear, close friend of mine, Rose Toehe. And Rose has been a longtime friend of the museum and works with the county in the Coconino County. Or are you with the city now? I forget. You're with the county now. With the city. I'm sorry. So without further ado, I'm going to let Rose take it over. And from there, she and Dr. Bernard will have a conversation with you about what's going on the Hopi and Navajo reservations and efforts to fight against the coronavirus that's spreading out there so quickly. So Rose, please, by all means, take it over.
First, thank you. Thank you everybody for joining us, and I really appreciate all the support and good thoughts that would be coming this way for our people, and just want to say thank you for your time this morning. So I just want to say a quick introduction. First, I want to do what we call, as Indigenous people, we try to really do land acknowledgement. And so I just want to say a couple things regarding that. So since I work for the City of Flagstaff, it is recognized that the City of Flagstaff is built on sacred lands loved and respected by Indigenous people since time immemorial. 13 Indigenous nations have known and inhabited these areas before Flagstaff was incorporated in 1928. Flagstaff City Council has further recognized in its proclamation for Indigenous Peoples Day that it was built and is still being shaped today with Indigenous people's knowledge, labor, technology, science, philosophy, arts, and commerce. So I just want to make that statement on behalf of our land. And I think that land is a living thing, our Mother Earth, and that it needs a voice, and we give it a voice through us as the caretakers. And so I just want to say that. And then I just want to also say that that will in itself be turned into prayers. So I just want to say that at this point. So my clans are Toehe Chitni no Dai, which is red straight running into the water. And I'm born for Kenneth Chitni, the Red House clan. And then my maternal grandfather is the Shihi, the Salt clan. And then my paternal grandfather is Hashkahatzohe, which is Yucca strung together. So that's who I am as a Dene woman. And I always introduce myself as the Indigenous child of the land. And my lineage comes from the Navajo and Ute nations. So my name is Rose Toehe. And currently I work for the city. I am the coordinator for Indigenous initiatives. I started my work with the City of Flagstaff in February, just right before the pandemic hit. And so I've been working from home since, and it's been, I've worked from home before, so it hasn't been a challenge, and I really enjoy my work there and my work with the city. Also want to just share the information that we're sharing today on behalf of the Navajo Nation and the Hopi Nation. I just want to also say that for disclaimer purposes, that although I am an employee of the city, I also want to just express that I do not speak on behalf of Navajo Nation or the Hopi Nation. I am just a relative who is speaking my heart and hopefully give voice to those that need, that are in need. And so I just want to say that, and also just say that a lot of the things that I say are my own personal opinions and not the opinion of the City of Flagstaff. So I just want to say that. Thank you very much for your time. And then I also want to introduce my very dear relative, Dr. Ken Bernard, and he's going to also introduce himself in his own way. And I really appreciate his time for being here as well. Yeah.
So my name is Dr. Ken Bernard. I am from the Turtle Mountains in Belcourt, North Dakota. I'm a Anishinaabe, or Chippewa, or Ojibwa is the anglicized word for it. My people are from the Great Plains. I'm now here in the Navajo Nation. I live in Flagstaff, Arizona. Enjoy visiting the museum very much with my daughter, and hopefully soon to take my, my young son. I've been out here as a practicing physician for the past 5 years. I'm a second-generation Indian Health Service physician. My mother is a family medicine physician and a general practitioner who's been practicing on reses for the past 2.5 decades. Did training out east, met my wife Kelly at Yale, and then trained in Boston, and then have been out here ever since. Always knew that sort of Indian Health Service was a path I was going to take, and that minority health, especially acute care in indigenous communities, was where I wanted to practice and try to make an impact. I myself am also, you know, a recovered or COVID survivor. I guess I had COVID in the beginning of July. My son was, you know, 2 months old at the time, and I kind of felt like a deadbeat dad, just hanging out in one of our downstairs bedrooms while mom was picking up the slack for me. But thankfully, it was a very mild course. I am so grateful and appreciative of that, because, you know, there have been people that I know, patients that are younger than me, who have both died or had prolonged hospitalizations and whose lives are forever changed. And I'd be happy to talk about those experiences or take questions about that, because I know it's somewhat confusing on why some people recover and respond the way they do, and when others don't respond as well. So I'd be happy to talk about what my personal experience was with a very mild case, and also some of the other stories, both, you know, heartwarming and heartbreaking, that have been experienced over the past few months. And also a disclaimer, I speak for myself and personal experience that I have with my patients. I don't speak on behalf of any tribal nation or government entity. And a disclaimer too is that I'm a business owner here in Flagstaff. So we have a staffing company, Pinnacle Emergency Medical Group, which brings temporary staffing and contracting services for emergency medicine to mostly the Navajo and Hopi nations. But this work is done outside of that, and this is not meant to be a commercial representation or me representing the company either. So just to make that known. Oh, also, everybody's job up until this point is you are supposed to be a public health advocate. But to be clear, I'm an emergency medicine physician, and also have an MBA. So I am not an infectious disease specialist, nor am I have a master's of public health. So that is also my clinical and professional background, and I just want to be clear about that too.
Okay, so I think we don't really have any questions right now, and I think that as they might roll in, that might be something that Amelia or Kristen will be sharing with us. And thank you for your background management back there. So I just want to say thank you about that. So one of the things that I do as my responsibilities for the city is to keep City Council informed of some of the things that have been happening with Navajo Nation and the Hopi tribe. Some of that includes informing them of the positive cases, the death rate in recovered cases, and then also some of the funding that they have received throughout this situation with COVID-19. And so some of that includes just the work that's being done right now with Navajo Nation, with the funding that's been received from the federal government, as well as that has gone into Hopi Nation. So it just having that knowledge and trying to make sure that people understand that although those are not quite a direct relief to the people, it's about trying to make sure that they have infrastructure and running water and electricity that, especially on the Navajo Nation, I have the more statistics on at least 30% of the population not having electricity or running water. And so Navajo Nation is really putting a lot of those resources into just making sure that those population that are without or at least having some sort of relief in their homes. And so I was just reading yesterday that there were approximately 500 people that finally received, or not 500 families that finally received electricity after all these many years of having everyone else, you know, pretty much in the United States having electricity. And so those kinds of things are happening now across Navajo Nation lands. And I know that with Hopi, there is information that there's a CARES Act committee that is headed by one of the very well-known advocates for the Hopi members, Carol Onse, who is heading up that committee and making sure that the right funding, or the funding is going to the right people who can move forward those projects that are needed on Hopi lands. So those are things that I'm able to share. I think at first it was really devastating to me personally, just having to hear about the numbers climbing, and then the death rates, you know, that information. It was just really, really humbling to me that we could really actually begin to rely on the strength we have within through our ceremonies and our prayers and our different faiths that we have out on the lands. And I think that those are some things that have been able to really pull the nation, at least these two nations together, and begin to really pull forward in making sure that their families are healthy, and to really begin to watch out for each other. And I really appreciate that in this time, because our nations are very, our nations people on our lands are very social people. They love to help each other out in ceremonies or in weddings or in birthday parties, anything that promotes that kinship, that relationship and the kinship and the clan system, and always making that a part of their everyday living is one of the things that I think was, aside from having multi-generational families within one household, it was really also the fact that our people are very social people. They are not, they are also people who, like I said, who really help each other in the ways that are needed out there. And so when there's a planting season going on, they help each other plant. And then when the harvesting happens, they help each other gather the harvest. And so those are some things that also might have played some role in spreading some of that, some of the virus. And so I look at that, but also those the very same things keep the people resilient and strong. And so I think in that way, I'm very thankful for our elders who have instilled in that in the younger generations. So those are some of the responsibilities I have at the city, and trying to make sure that there are certain various different indigenous initiatives are being spoken about and being highlighted, so that some of the members here in Flagstaff are able to have a voice and be able to have some of these things. And I'll maybe go into some of that later as to how this position that I hold now is a community-driven position. And that's one of the things that I'm very grateful about in making sure that some of our indigenous voices are here and heard at the city level, but also helping to strengthen our relationship as a city with our neighbors, indigenous neighbors in the area. I'll again give it to Dr. Ken.
Yeah, thank you, Rose, for those lovely words. And I have to feel the same with regards to the heartbreak and the initial concern of when cases started to rise. And then we started to see new clinical presentations that we had never seen before, meaning younger people who were sicker, needing hospitalizations, needing to be put on a breathing machine. And then finally, to what I think today, or maybe yesterday, there was no report of any new cases of COVID on the Navajo Nation, which is the first time that that has happened since March. And again, I think we're seeing something across the nation where cases have been plateauing and maybe hospitalizations have been going down. Many reasons for where that might, why that might be happening, but it does appear at this point in time that we might be in or trying to just start the recovery phase for all of our communities. Again, some of the things, and I'll just echo what you said initially, was this virus had shed a light on the lack of public health infrastructure and also the disparities in basic needs. And those basic needs often being referred to, at least by the WHO and those in the public health field, as social determinants of health, meaning they are the basic foundation and things that are necessary for human beings to live a dignified and respectful life in the way that they see fit with their values, their culture. And of course, we've known, and Native American communities have long discussed ever since, you know, healthcare was taken over by or put under the jurisdiction of the War Department or the Defense Department, and then finally went into the Bureau of Indian Affairs, and then finally to Health and Human Services, which the Indian Health Service is now under, that the infrastructure has been lacking and lagging and underfunded. And then we started to see the cracks that got all the more apparent when there was this huge demand, a surge in demand on what the system needed for Indigenous people. And again, because that system wasn't delivered, what you're mentioning and talking about is the resiliency of community members taking care of themselves. Being innovative and finding ways to care for elders that maybe didn't have electricity or didn't have running water or didn't have the basic necessities, or we're no longer able to like even get out to go to the grocery stores, even though we know there are only 13 of them that are on the Navajo Nation, which is roughly the size of West Virginia. And we all hear these things about food deserts as well. So those barriers, again, with a system that was poorly which was poorly set up to be able to manage a public health crisis like this, forced the communities to be more resilient and innovative. And truly you can see that now. And again, like just neighbors helping each other, trying to give each other spiritual and emotional support, and doing what they can to bring each other through this. And now I think the important aspect of it is what you mentioned was advocacy, making sure that Native and Indigenous communities have a voice, that these voices are then influencing and affecting public policy, and hopefully bringing more needed resources to our communities, our Indigenous populations and communities.
Dr. B, can you tell us a little bit about just what your personal experience was with COVID, and then just what it is that maybe some of the things that went through your mind during that time?
So, I mean, I will speak professionally. I was almost ashamed now looking back of how naive I was initially when we were faced with the initial information that was coming in the November, December from Wuhan against about the number of cases, the incidence, the virulence and infectivity of this virus, right? I mean, myself, many of my colleagues, even community and tribal members were like, it's not going to come to the res. First of all, you can count on probably one finger, right? The number of community members that have traveled through Wuhan. We thought it was just going to be an endemic problem. We didn't have an idea or a sense at that point that it was going to be a global pandemic. But come January, when the first repatriated flight came to Alaska, and then we started to have news of community spread, by February and by March, we were all getting much more concerned. Meaning questions started coming up, and physicians were starting to toy with the idea of like, what if I have to put multiple people on a ventilator and watch them for many hours in the emergency department? How is that going to look, and how is our system going to respond? How are we going to be able to send community members home with supplemental oxygen if they need it? And how are we going to get those resources to them? So I have to admit, early on, right, the November, last winter time, I was incredibly naive and was maybe more hopeful that it wouldn't come or reach the places that we work, because we knew it would be devastating. And then by January and February, that reality was starting to come more and more clear. And then by March and April, when we started to pick up in cases in the hundreds, that became that reality then came to the fore, and what we had expected to happen happened, meaning a lot of people were presenting to the emergency department that needed intensive services, meaning they were sicker than they usually are, so they would need more care from a nurse and more care from a physician, and then usually they would need to be transferred out of the facilities on the res, just because they needed critical care, an infectious disease specialist, and because there was an understanding, or there was a thought, we really didn't know what the course of the virus was going to be for most people at that point in time. So there was a concern about how many services would they need, even if they recovered and got better. You know, would they need a longer term rehab? Would they need to go home with oxygen and other medical devices, for example? So professionally, that was that up and down. And then I have to say, now thoroughly, we are in the thick of it. Now we're coming on to this end of cases are going down. I'm not seeing as many sick people and as many people that need hospitalizations. They're still there, but we're still but that sort of has let up a little bit. But at the same token, I think the grind professionally has been the uncertainty that we've gone through, and I'm sure every patient feels this and every community member. But now I don't necessarily know what to expect once what we call, the respiratory season picks up, which is going to happen shortly. And schools have opened back up, and children are going to be going back to schools and spreading all these little respiratory viruses around, and how COVID is going to interact with that over this winter season, which is always very difficult for us, because flu and indigenous communities is difficult to deal with. People get sicker with flu, and then they also need to be hospitalized, and they also die more from flu in tribal communities, just for those reasons that we talked about, that Native people tend to get sicker than our white counterparts from all diseases. So again, it's the uncertainty now that's sort of been it's been hurting morale for our healthcare workers, and again, it's to the point where we're like, are we ever going to see an end to this, or are we ever? And the other things that have been going on is each new phase, when we learn something a little bit more, from the preparatory phase of, okay, let's bring in all the resources that we think we're going to need, to the actual treatment and response phase, to we have to switch around how we're treating patients, or creating certain care pathways for patients. That had been changing. So it also feels like you've never been in a good rhythm of how to handle these patients when they've come in. And again, that's challenging. Imagine you go into a job and there's something that you expect, your usual workflow, and that can change minute by minute, hour by hour, and day by day. And again, you have just more and more people coming and asking for services that can wear on a healthcare worker. So I think it's cognitively and emotionally been very challenging, and that's professional and overall for me. The personal aspect of it was, like I said, I have a 4-month-old son now. He was 2 months old then. And then I have a 4-year-old daughter who has some respiratory issues, especially during the winter months. And my wife, who is postpartum and is generally healthy and great, but when I knew I was in a high risk profession, I had been prior to my son being born, I stayed out on the res for the entire month and just worked shifts, and that was because, again, if I was already there and I could be of help, I wanted to be of help, so I stayed out there for a month and didn't come home. And also, I wanted to be able to spend some time at home to quarantine before we went into the hospital to have the baby. Then I was right back on the res shortly afterward. I can remember the first time I walked down the stairs. I just felt like I was tired. You know, I was waking up with the 2-month-old, and it was 5 a.m. and it was my turn to get up and change him, and just thought I was tired. But then I walked downstairs and literally lost my breath, and you know, my heart rate was up in the 130s. And normal for people is anywhere between 60 and 80. Anything over 100 we call tachycardia, which is not normal. Or can be signs that you have an underlying health issue. And for me, it was because I had a fever and COVID. We immediately distanced that night, and I, you know, stayed down here in my office, which we made the COVID bunker. And then I went about trying to get testing. And again, that's another issue we can talk about altogether, about how somewhat frustrating that has been. But I was able to get testing scheduled in about 24 hours with my primary care physician, and the results were available. They said 3 to 5 days, but they came back in 3 days afterwards. That's not been the experience for a lot of people, meaning, you know, when they get to the testing site, waiting for 4 or 5 hours, and then maybe having 7 to 10 days report back. And then I guess a little bit more personally on that experience, you know, my wife and I literally had the conversation. We were Zooming. I was here, she was in the dining hall, and she was like, do you remember if we did our will and testament or finished that up 2 years ago? And I was like, here I am. I think I don't look it, but I'm still a young guy. I mean, I was 36 years old and having to talk with my wife about will and testament stuff and what would happen if anything happened to me. And that had not hit me like that before. And so we started to have other, you know, real serious conversations about, oh, where do our kids go and who will they go with now? And how will they be taken care of? And then that personally, I think was the, not draining, but it was certainly the wake up call that I needed to be a bit more, activated in the issue. And again, I hope for anybody who's watching or listening right now, I hope you take seriously to heart that now your second job is to be a public health advocate. And then if you recognize that is your job, that in your community that you advocate and engage and try to understand those policies that are affecting the public health of everyone. But I would also, you know, recommend that you pay attention to those populations that are the most vulnerable and are going to suffer the most when another pandemic like this hits, and that you actually become engaged to speak up about those issues that we think are unfair and unequal. So again, that was definitely a moment personally where it struck me the most. And then it's just been taking that sort of energy and sometimes even anger and frustration and putting it right back into patient care and saying, hey, we can make at least a difference. We can learn all we can about what we know about COVID and try to care for these patients as best we can. We can help these hospital systems respond. We can share information with each other about what's working and what's not working, and we can have forums like this to talk openly about you know, professional and personal journeys through this time, which has been unprecedented. So again, I want to thank very much for the opportunity to talk and be part of the discussion. Thanks.
Thank you for your kind words, Dr. Bernard. This is Amelia again. Just a quick question that's come in. You mentioned concerns with flu season coming up. And so how do Navajo and Hopi people and other people in rural areas, a lot of our friends on the reservations, how can they get access to those flu shots? Are there medical teams that go to them so they don't have to travel, or what does that look like exactly?
Yeah. So first of all, I want to talk about, with regards to treatment and people being in response to prevention, about what's coming next. Thank you so much for the question, and it's so important. Everybody should be getting their regular vaccines, meaning you should be getting your flu. You certainly should be getting your flu vaccine if you're in those high risk or vulnerable populations, and most certainly children. And for you elders out there, you should be getting your Pneumovax vaccines, and children should be getting their usual vaccines that they would get from their pediatrician. There have been some great, so the Navajo Nation, as well as the Indian Health Service and HHS, again, every year have to make estimates of how many doses that they think they would need. And then they try to get those doses for the populations that they would need, who would need them most. and I know of a few programs. For most people, it's going to be, you can set it up with your primary care physician, or hospital or healthcare system will set up flu vaccine clinics to where, you don't need to see a physician. You don't need to check into the emergency department and see a doctor to be able to get a vaccine. But these now can be delivered either by nurses and or can be delivered. Now there's been sort of an expansion of scope that state licensed pharmacists can now give vaccines and will likely be able to give the COVID vaccine when that becomes available. So even stopping by a local commercial pharmacy. But for most of our community members in the Navajo and Hopi Nation, what it will be is going or checking with your local service unit, and then finding out when they have their flu or vaccine clinic. And most of those are walk-ins, so you don't need an appointment or anything like that to do so. As of right now, also for kids, they have school clinics as well. And now they're having like drive-up flu clinics, or they'll have drive-up vaccine clinics. Again, just another part of the health system trying to be resilient and innovative. As of right now, I'm not aware of mobile health units that are going out to people's homes individually to vaccinate, or sort of global vaccine plans. But I think if you were to go to the Navajo Nation Department of Health, that they would be able to have more information like that. But I'm not aware of any formal program right now. But I can try to look that information up and maybe follow up in an email or something like that. Or if anybody is watching and could correct me, please do.
Thank you, Dr. Bernard. That was a great answer. One follow-up question: where can people find information about what is in the vaccines before being vaccinated?
Yeah, this is a big issue too, right? Because we've all heard about the numbers of people that are concerned about a vaccine, especially being brought to market that doesn't show the appropriate safety and efficacy requirements. And even in the news today, there is something about AstraZeneca having to put their trial on hold because of an adverse patient reaction. And then there's also the news about, the 9 CEOs of the big pharmaceutical companies coming together with an agreement that they would not put a vaccine in market that wasn't proven to be efficacious and safety. So they wouldn't go for that emergency use authorization. A part of me says, thank you guys for doing that. The other part of me says, I can't believe we're in an environment where we even have to reassure people that we wouldn't put something out to poison them or to hurt them, right? As a medical community, and I include, insurers, pharmaceutical communities, as well as government regulators and other health entities, public health entities. But again, Native people, indigenous communities, minority populations have been tested on without their consent, right? They've been given medical treatment without their consent. There's been, there were case reports and stories of even like mass sterilizations without consent, going in for something else and having something done to your body that you didn't expect. So for most of these, you can find information both on the CDC website about vaccines just in general, how safe they are, how important they are as a public health tool and intervention, and that the vast majority of medical professionals recommend it, including myself. And then secondarily, usually information will come both from the trials and both like the trials that would need to be published for them to receive authorization to bring to market, and most certainly from the websites, the pharmaceutical companies' websites. You can find information about their drugs and vaccines, and any one of these entities have numbers that you can call and customer service folks that can answer that question. Again, so there wouldn't be any time where I think you could have a medication or something as visible and important as a vaccine, especially as it's going to be expected to give to vulnerable populations, and probably would be given to healthcare workers or frontline clinical workers, that wouldn't have to state the process for which it was tested, the results of what that test was, and then how it is manufactured, made, and what the components of it are. Oh, the other thing that I would add about this is, sorry, right now there is so much focus on a vaccine as though that is going to be the end of it. But truly, I just had a wonderful talk with Dr. Mark Poznansky. He's the director of the Vaccine and Immune Center at Mass General Hospital. The most insightful thing that he said is, like, everybody's waiting for a vaccine, but everything that we need is already at hand with regards to public health mitigation and prevention of what's happening right now, so we can go back to a safe way of living. So, and although inconvenient at this point in time, masks, social distancing, washing your hands, and then making sure that we have the public health infrastructure to test and contact trace, and then isolate those folks so there's less community spread. So the interesting thing is, we already have pretty much 95% of the tools that we need to actually recover and get over this. And it's a little scary that we're putting, so much weight on a vaccine, when that's only a partial tool. It's only part of the solution moving forward, and the majority of what we need is already there and at hand. It just, everybody needs to take part in it, and needs to buy into it, for one another. But it's been tough, especially in this current climate, to convince everybody that that's what we need to do.
I think one of the things that really helped, again, is the fact that Navajo Nation, including the Hopi tribe, they were able to shut down right away and just go all out and say, please distance, please mask, please, all this stuff. And so I think that just what Dr. Ken said about what we already have at hand, those are the things, that was the messaging that went out right away. And even though the numbers were climbing, now we're able to say that we've gone to the point where there's less death, and there's more, we have information on recovery. So that makes the numbers less disheartening, and there's more hope. And that the people have really decided and really to take into their own hands the part that they can really participate in. And I think that's been really good in the realm of this, the cycle of this pandemic. And I really think, people like Dr. Ken and the people that are blessed with those talents of medicine and of knowing what health guidelines to go by, and being out there in the front lines and telling our people what they need to do and what they must keep doing, and then and putting themselves out there, and just doing what they need to do to help the people. And I think that those are just, when we were blessed with so many good people that way. And I was in a position where I was able to, when I get calls or get messages on people such as Direct Relief from California, where they contacted me and said, what do we do to help the Navajo Nation? And so I was able to connect those donations and those people that were contacting us in the city of Flagstaff and saying, what can we do to help? And so I think those are some things that are very important in the areas that we're able to connect the help that's out there. And then that goes along with some of the grassroots activists and grassroots people. These are professional young people who have gotten together and able to maybe start funds to help out with the very first time when it started out, and the federal government wasn't immediately available with the funds for the nations. And so these were the times when I saw that coming together of young professionals and those people who knew the technology and how to get this started, I think was one of the things that really helped getting food and water and whatnot to the people out there, to the elders and to the single parents and to the people who had conditions that where they couldn't go out and be able to go to grocery store because of their health condition. Also because a lot of our people didn't have vehicles to go and travel and get the necessary essentials that they needed on a daily basis. And so these young people got together and made it happen. And they were out there delivering food and water and whatnot. And that's the reason why I was really grateful when Amelia contacted me and said, this could be a fundraising opportunity for some of these people that are still in the trenches doing this work for our people. And the only one that I wanted to really contact was Dr. King, because he was out there in the middle of all that and protecting our elders or protecting our children and also his colleagues. And so I just can't say enough thank yous for that. Yeah.
Thank you for your kind words, Rose. Really quick, just going to jump in with a question. So the question from Kathy O'Mara is, what would you say are the best and most honorable agencies or nonprofits who are reaching out to help the people in need on the reservations? And can we provide some links? So really quickly, I will say that Rose has already shared several options. Two of those are the Navajo and Hopi Families COVID Relief Fund and the Kinlani Mutual Aid Organization. Both of those donations, links to those donations and Venmo and PayPal accounts are available on this event on the museum's Facebook page. And I know, Dr. Ken, I know there were other organizations that you recommended. So outside of that, are there other organizations that are still continuing to make those efforts? Because obviously there are still people who need to stay in their homes and can't go out to get their own groceries, and there's more money needed for different support. So what are some of those that you might recommend?
So the Navajo Times has a great coronavirus update, and they have a page that's relief for coronavirus and has about 7 different links that you can go to for donations. The other one that's not on there that I really back is an organization called With Love from Strangers.org. Again, started by a pediatrician who practices here on the Navajo Nation, who got together with Angel West, a flight team, and got people to volunteer supplies and time to be able to bring down care packages, everything from PPE to sanitizing wipes and things like that. Again, so those are sort of the 2 main resources that I would go look.
I think that if one of the ones that I would recommend that helps globally is Direct Relief out of California. And they are really good in going to those hot spots and helping give out that relief. And I think that would be one of the good ones to also donate, because they've really helped a lot of indigenous nations, and especially Navajo Nation. They've sent a lot of PPEs, a lot of different things that the Navajo Nation needed. And I think that when you help organizations such as them, they're able to help globally. And I think that's a good thing to always give back. And just like our Native people at some point, the Cherokee, the Choctaw Nation had helped Ireland. Those are just some things when during the Great Depression or during the time when there was great famine out in Ireland, that the Choctaw Nation got, even if it was a small amount of money, out to Ireland. The nation of Ireland helped our people out here during this pandemic. You would not know just the amount of thankfulness that their people gave, and they're sending those monetary donations to our nations out here again. And just that respect and that kinship from across the oceans is just things that are out there and we're so grateful for. So in this way, I think that having to donate to some of those relief funds, such as Direct Relief, it would be good too, as well as the ones that we mentioned. Thank you.
Thank you, Rose and Dr. Ken. So I know early on in the pandemic, there was a shortage of essentials being delivered to the reservations. What is the situation now with those essentials being delivered and access to those necessary supplies?
I can speak to the PPE. It was, yeah, initially, I would have to say there was quite a concern that there was going to be a shortage. Again, I can't tell you, 8 months ago, last year, this time, I would never given a thought to whether or not I've had an N95 or a PAPR, which is a protective respirator. I just took those for granted that those would be there. And again, in March and April, we no longer could. So, we had other people that were donating supplies, like from with love from strangers, academic medical centers who were reaching out and helping out, even industry and local businesses, again, that were transitioning to do things like, hey, we'll create hand sanitizer, and another facility saying we can fabricate reusable gowns for you. And then even internally, we had directors and frontline clinical workers that were talking with each other about, hey, we can share this resource, meaning, if you're running low on gowns this week, here's an extra 50 or 100 gowns that you can use until your inventory shows up. So that's some of the stuff that was happening. I would have to say today, for all just speaking for the facilities that I work at in the Navajo and Hopi Nation, we're doing much better, and I think our inventory and stockpile has gotten better too. So inventory management, especially in the middle of a crisis, is a very difficult operational thing to handle. But everyone's incident command, and then also the assistance from local community members, businesses, and the federal government, now I think for the most part, at least the hospitals are doing okay on supplies. But I couldn't speak to the direct need or essential need for community members. But Rose, maybe you could.
I think the direct need, direct relief to the families, as far as essential needs like food and water, is still essential, because even though Navajo Nation, just taking for example, the Navajo Nation has received a huge amount of money, the infrastructure itself in putting in getting wells or getting water or even electricity is still going to have some limitations to some families, and maybe not everybody's going to get the electricity and water as some of the families are getting right now. But as far as the essentials like food and water, and especially for people who have been out of work for so long, they don't have the paycheck to pay for the food and water, plus much less gas to go and get those things. Then they have children, there's diaper needs, and there's things for pets, maybe hay and grains and things like that they need that they would normally get if they had a paycheck. So those things are still needed. And I know that the relief funds that I mentioned, I know they're still providing those, because those are needed on a daily basis. And so those things are always going to be needed. I know that right now, some of the things that is being done is that they're getting ready for the winter season, because they know that with the flu season coming and probably a second wave of COVID, there's going to be a lot more need during the winter months for those people that are probably going to be without work, and who live way in remote areas where the roads are not paved. And so those are some things that are still things to consider. And I'm thankful for these young people that are trying each and every day to get those essentials to the people. So another situation is our traditional practitioners. I know that they're in need too, because their work is to be out there to help families, and yet some of the offerings that they get from the families are not going to be there. And so some of those relief to traditional practitioners are also always a need. that are going to be continuous. So that's about all. That's a lot, and I really appreciate that time to say that. So Amelia, I don't know if you have any more questions, or but I think those are some. I think this is a good time that we've had together, and I really appreciate the work that you're doing in helping the artists in whatever way you can. I know there's also artisan relief efforts, some from different areas. I know the museum is involved in some of those efforts, and I really appreciate that as well.
Yeah, my dear friend, I appreciate that. The museum, it has a long history of supporting Native artists. We have several initiatives right now, mostly through social media. We're discouraging people from going out and physically buying art, but if you can support an artist online, however you can, it does provide a lot of assistance. I forget the numbers off the top of my head, but I know the majority of funding for a lot of income for a lot of Native families comes from art sales. So however you can support artists virtually, please take the time to do that. So we have about 10 minutes left for questions. So if you have any other questions or comments, please do so on our social media stream of this Zoom conference. We'll be able to answer a few of those after we disconnect from the live feed. But just wanted to provide one more opportunity, Rose and Dr. Ken, if there's any other thanks or comments that you have, please take this time to do so, and we'll get wrapped up in about the next 2 or 3 minutes.
Yeah, my only comment at the end of this is that, you know, this pandemic has brought out a lot of things in our society and our communities, both good and bad. But moving forward, just that people could harness mostly good. The resiliencies that communities have shared, the care that each one of us has shared for each other, the advocacy and empowerment part of it, meaning that you have the ability to control and care and take care of yourself and take care of your others, especially in your close community. And that after this, I hope people are inspired to become a bit more engaged. Donations are fantastic, necessary and needed, absolutely. But what's really additive to that would be advocacy and voice, to me, to be able to shift policy and to correct some of those inequalities and disparities that we're seeing in our minority populations, but I would say in rural America in general, which are often forgot when compared to the big cities that already have all the resources that they need. So that would be one of my pleas, is for people to get engaged and advocate for their communities.
And I would agree with Dr. Ken. I really appreciate the time that he's given to help us with this conversation. And I just want to also say that one of the things I think is really important is that I really, I'm sorry about the phone call, the phone ringing. I don't know if you can hear it, but I think one of the things that is very foundational to me is just to always reach out in kinship. We're all related. We're all five-fingered people. We all have the same colored blood running through us. And we may have differences in skin, but we are relatives. We're one big circle. And I think that we need to always remember that. We are spiritual beings. And we need to remember who we are spiritually, and we need to help each other in that way. And so I think this is one of the things that I would always recommend, I would always encourage and support, is that we always reach out in kinship and remember that we are all related. Thank you.
Thank you, Rose. That was beautiful. We have a few questions that have come in. This one's from Ethel Branch. It's a two-part question. what is a realistic timeline for a safe vaccine to be available, and how long do you think it will take for it to be widely disseminated and effective?
I'll take this one. It's a challenging question. It's been a moving target, and again, is dependent on. I believe there are 5 companies that have vaccines now. Most of those might be in clinical stage 3, which is they're testing it out for efficacy and safety in human trials. And then the distribution, or the second part of that question is the incredibly difficult question and logistical question of availability and distribution. I mean, wrapped up into that is like even, ethical questions about how do we have equitable distribution, meaning that everybody would have equal access to a vaccine should they want it, but also that we have policies and a strategy in place to give it to those people who are most likely to benefit most, meaning they would have the most to lose because either they're the most vulnerable or they're going to get sicker, or they have a higher risk profile. So it's a really challenging question to ask. With regards to what I know right now, at least from what the studies are showing us, is that they're saying, hey, anywhere between November or December, we think that we could have a viable vaccine. Like they already have the target, but they could have a vaccine that has been shown or passed phase 3 clinical trials. And then it would most likely not be ready for dissemination, I would probably have to say, until the end of the first quarter of next year. That's if something came out in November, and then to think about to create somehow like 100 million doses, 300 million doses that you would need to distribute, and where those are going to be distributed first, an incredibly difficult question. If we're talking about what happens usually, I mean, this is a timeline of years that we're talking about for some vaccines and for some medications. This is a vaccine that's going to be brought to market in less than 18 months. So it is an incredibly accelerated timeline, both because of the proximity of the problem and how much publicity this has had, and also because it's just been a very virulent virus to deal with, and has been incredibly disruptive. So that's why there's so many resources going towards it. So my real answer is, I don't know. But my hopeful answer, or my thought based on the information that I have today, which is the same that every other person has, is that if they put something out in November, the chance that it's going to be widely dispersed is maybe February and March for most people.
Thank you, Dr. Ken. One other question, I will answer this one. We had a question about, is there a website to purchase jewelry directly to help the artists? And that's a kind of complicated question. One of the problems that has been come into the limelight is the lack of internet access for a lot of artists on the reservations. So one of the best ways that you can support, the Swaya Indian Market in Santa Fe has actually developed websites for a lot of artists. So if you go to their website, that's a great option. The Museum of Northern Arizona's website shop also supports directly Native American artists. But ultimately, one of the best ways to support is through social media, actually. There's many artists who have developed a great social media following for selling their art. And if you want to support artists, I highly recommend using your Facebook, using your Instagram, and seeking out Native artists and buying directly from them. So on that note, we're going to go ahead and wrap up this presentation here. I just want to give one final thank you to Rose and to Dr. Ken. You're both absolutely doing marvelous work, and as a member of our human family, I'm grateful to both of you for the work that you do on behalf of all of us. For those of you who are continuing to look for ways to support the efforts in fighting the coronavirus on the reservations, please keep an eye on the museum's website, and we'll continue to share that information as it comes available. Yeah, thank you.
Thank you, everybody. Go ahead.